Hi, my name is Judith Gregory. I'm a registered nurse and also the mother of 4 children with special needs. We participate in research studies at the National Institutes of Mental Health in Bethesda, Maryland. And I just want to share why that is so beneficial for our family. I'm a NAMI member from the Lawrenceville, New Jersey office and have been involved for many, many years. NAMI was very helpful when my children were first diagnosed, very supportive. We do the walk every year, and I follow their websites and newsletters, and we love it. Love NAMI. Because NIH is the center of our nation's research program for all medical diseases, they have a huge study on children's mental health issues, and we are in particular involved in the childhood bipolar study. But ours is not a treatment study, so we don't receive any kind of medication or inpatient services. Everything they're looking at is done outpatient. And we go down to NIH every other year, and we stay for a few days. They put us up at a beautiful children's inn that is just magnificent. The staff are fantastic. And we do some very simple tasks, computer tasks, that my child gets reimbursed for and really enjoys. And he has the option to do an MRI brain scan, a functional MRI. He chooses not to do that. He's a little afraid, and that's totally okay. It doesn't exclude him from the study. All of my children have some sort of mental illness, and several of them have developmental disabilities, and several have a mix of learning disabilities. So all of their symptoms, many of their symptoms, I would say, overlap. I only have one child formally in a study. However, I have 2 other children who the nurse is sort of following informally. She has a file on them, and I can call any time and get them in the study or just ask questions. And that's the real value to me as a parent. When we were diagnosing my child during those very awful early years of childhood bipolar, going to NIH and learning about the real symptoms, differentiating diagnoses, was just crucial. And then I could take that written information back to our local psychiatrist and share that with him, and it's seen and valued as sort of the bottom line. And that at the time of crisis, that was just very valuable to us. And anytime I need anything, I can call my nurse, my contact person, and get a referral, get more information, clarify something. Well, my son is 15 now. I think he was probably 8 when we started. So several years. He loves to go down. He loves it, you know. No, they're very accommodating. You know, they let you know about the time cycle when you're due to go down, but scheduling is completely at your convenience. So and the day itself, the days you're there working, is not strenuous at all. There's ample time to take your child to lunch, to get some rest, to even see the town. So it's not strenuous, because they know the population, and they know they're very kind to the children. When we were early on in diagnosing my son, we saw, as I'm sure many parents do, many psychiatrists. We had opinions from the school, we had opinions from family members, we had opinions from other doctors, and it was very confusing. But to have an authority on the front line of national, international research on childhood bipolar tell me what was what, and what symptoms are what, and what was ADHD versus what was mood disorder. It was just the most precious information. People mostly think of a treatment study. You know, they want to find the med that works, and I really understand that and have been there. But there is also information that's gotten from NIH that is you can't get anywhere else. It's frontline research information. So right now in my particular study, it's a general child bipolar study, but they are separating out what is, they think, early onset childhood bipolar versus severe mood dysregulation. So that's a new category in the DSM-5. And they're following, it's a longitudinal study, which means it'll go from when we started to age 21, assuming he continues to want to participate. And they're trying to see whether children who are diagnosed early on with the bipolar symptoms actually do grow up to be adults with bipolar, or does it change into something else, or does it go away? And what I've been told by my nurse is they're actually finding children with severe mood dysregulation tend to not grow up to be adults with bipolar. So that is not a definitive, study announcement, but that's the feeling that the researchers are getting. And that's really hopeful to me as a mom whose children have been diagnosed. To participate in a research study does not mean you're a guinea pig. It means that you're just sharing your experience with people so that they can help classify the symptoms your family member has, to compare them to other people in the country to see what is happening. And that's really all it is. So there's really nothing to fear. It's they're not going to label you. They're not going to put you in a category. They're so respectful to my son's boundaries that every time they do a test or a computer skill, they always ask him right to his eyes, are you comfortable doing this? You want to do this? We can do this another time, or you don't have to do it at all. And so that he really, really feels that he's in control of everything that happens. And sometimes he does say no. And we praise him for that, because that's part of him, participating in a study. And that's okay. It doesn't ruin the study if you say no to something. So I would just say not to be afraid, and to realize the benefit that you get from being in contact with our nation's leading research scientists.